You ready? Is it rolling?
Yep.
Okay. So
CSI, scene safety. We have a 21-year-old female supine on the ground, obviously after a traumatic motor vehicle collision. We're going to assess her level of consciousness at this time and then begin our scenario. Miss, are you okay?
I'm alert.
Oh, she's alert and oriented. Okay, so I noticed that her left forearm, she has bleeding. Okay, so attempt to control the bleeding. Going to apply gauze. So we have a 4x4. Is the bleeding controlled?
No, it's not.
Still bleeding? Oh Lord. Okay. So we're gonna apply more dressing. Is the bleeding controlled?
Negative.
No, it's not.
Oh my Lord.
More dressing than that.
So now we're gonna need to put some cling on. I'm gonna ask for my assistant to help me come hold her arm.
Assistant.
Please hold her arm for me. This is an attempt to stop bleeding from the forearm,
Thank you.
which is not gonna work, because it never does. Okay. So now I notice that the blood is still yet soaking through this lovely dressing I have just applied. So, we're gonna have to use a tourniquet. So I'm going to check PMS in this patient prior to tourniquet application. Pulses are present. Wiggle your fingers. Which finger am I touching?
Pointer.
Okay, good. We're gonna apply the tourniquet 2 inches above the injured bleeding site. Okay. Get around that. Okay, and now we're going to turn. I'm not going to turn too much so I don't cut off your circulation completely here in real life. Okay?
You're good. Keep going. Fine.
All right, well, you asked for it. Okay. And now we're going to say, is the bleeding controlled?
Getting
No.
control.
No, bleeding's not controlled. So for this scenario, I would apply a second tourniquet, same exact procedure, proximal to the injury. Sorry, girl. Just took off.
Probably missing everything.
Turn again. Not turn this way. Is the bleeding not controlled?
It is
Yes,
controlled.
Okay,
bleeding is controlled.
bleeding is finally controlled. We're going to reassess PMS. There is no pulse because the tourniquet will prevent the brachial artery from pulsing. Wiggle your fingers. And which finger am I touching?
Thumb.
Okay. So now we're going to label and time the tourniquet application with the date and the time of application, obviously, on somewhere visible for the hospital staff. So I would put it on her forehead. Now we notice that she has a broken leg that she's crying and screaming about.
Yes.
Come on, where's the drum?
No.
Okay, holding stabilization on the femur fraction.
Alright,
Manual
I have the
stabilization
ankle hitch.
applied.
I'm gonna throw this thing on,
Guys,
but
screws.
before we do that, I'm gonna check PMS here. Alright, we have a pulse. You can wiggle your toes. Which toe?
The big one.
Alrighty. And throw this ankle hitch on. Okay. Applying manual traction.
Okay, go around. Gonna measure it on the good leg. Good.
Yeah, that's still. We can never work.
Step.
Get it way around the hip. You missed one. What does that feel?
This one? You want to fly? Right here?
Lazy up.
Tell us when you feel relief, okay? Oh, okay. She feels relief. Okay.
All right. The pulse. You wiggle your toes. Which toe? Very good. Uh-oh, it looks like her other leg. Something wrong with it.
You have pain in your other leg too?
Yep.
Oh, her other leg's broken. So we gotta do some longboard splint now.
Okay. We noticed that. May I get here, please?
Oh, certainly.
We noticed that our patient have swollen in the knees. Do you feel pain, ma'am?
No. Yes, sorry.
Yes, you do?
Yes. Yeah.
Pain in the lower
Possible
leg.
tip for fracture.
Okay, there's a possible tip for fracture.
You're holding.
Take care of the pulse.
Alright, I'm checking for pulse. If pulse is present, can you wiggle your toes for me? Do you feel me touching?
Yeah.
What toe am I touching?
Like middle one.
Okay, so PMS is present. And now we're gonna go ahead and apply regular splint. Good to go?
Uh-huh.
We're applying these cravat just so it's tight enough to stabilize the leg and minimize movement. And we make sure it's not resting on the joint, so it's above the knees. And the knots are on the wood and not on the skin.
Professor. Please,
I'm going to assess and check for pulse.
Go ahead and check for pulse again. Pulse is present. Can you wiggle your toes for me there? Okay, you feel me touching? What toe am I touching?
Right.
Okay, good. So PMS is present before and after the splint is applied.
And now
Patient's good to go.
prepare for
Patient is
transport and
prepared.
transport to appropriate facility. We're good.
is it?
Thank you.
You're the man.
Sweet, bro. Thanks.
Thank you. What's
Hit
your
it,
name?
hit it, hit it.
Stop recording.